Everybody, welcome to this episode of Think Business. Looking forward to talking with Ben Blankenship and Aaron Renz. It's great to connect with both of you. I'm a huge fan of your product, Robotic Precision Therapy, RPT. It can be found at rptclinic.com. And so let's talk about it. So Ben, I see the machines behind you.
Yeah,
and you help people. You're in the world of kind of your machines to give gentle pressure and intervals and kind of to specific muscles. But the great thing is, when I come to you guys, I have a pain in my left shoulder, and you start working on my right calf. I mean, I'm making that up because I don't know anything, but here's where I want to start talking about, right? I want to rewind before we start talking about kind of the product and the machines that we see some of your patients on in the back. It seems to me that people are in more pain than ever before. It seems that people seem to have more ailments than ever before. I have no basis of data on that. It's just kind of a feeling that I have. And so, I don't know if it's the food we're eating. I don't know if it's, I don't know what that is. I'm not claiming to be anything, but let's start there. How can someone, why are we seeing the pain, and how can we be preventative when it comes to our own body? Aaron or Ben, I'll let either one of you kind of take that.
No, you're exactly right. I mean, I would say, especially since COVID, a lot of people are more sedentary. That's the biggest thing we see in office is just a lot of chronic pain from repetitive motion in general. More often than not, it's just people sitting at a desk all day, sitting in their car to and from work, and then they're sitting at home when they get home, and then they're going to the gym occasionally. And even if they're going regularly, they're probably doing a few bad movements in the gym. That's just exacerbating that imbalance that they're starting by sitting all the time. So that's the majority of what we treat is like back pain, sciatica caused by a tight hip flexor. We get a lot of like neck and shoulder pain, radicular symptoms down the arm, stuff like that. Just your standard neck and back pain. That's the majority of what we treat. But we treat anything from plantar fasciitis to TMJ to TBIs after an auto accident. So what we use the robot for is essentially the same thing we do by hand. So it's manual therapy. It's just applied by a robot, and it's a lot more volume in a very short amount of time. That's kind of the idea of the robot. So it takes the wear and tear off of the actual practitioner yourself, and it helps you get faster clinical outcomes. Because for me, we'll see 40, 50 patients in a day. There's no way I'm going to treat them all by hand for an hour a piece. It's just, you don't have the time, and your hands would be dead after a day. So essentially that's what we do at our office is we use the robot to mobilize tissue, open up joints, do whatever we need to do, take pressure off of discs and nerves. That's the idea, is just lengthen muscle quickly with the robot and get your patient back to neutral. So,
Aaron, any thoughts? Thanks, Ben.
I was actually going to add to that. After COVID, so everyone got an exercise bike at home, or they joined a spin class or something along those lines. And the position that the body is in order to cycle for those extended periods of time, we just saw quite an increase, both from people being sedentary and then also picking up a new exercise habit that was the same position again and again. Lots of low back pain, lots of people coming in with sciatica. In fact, sciatica is the number one piece that we treat right now as far as any issue that someone has, sciatica with low back pain. And it's just amazing. People come in and they'll say, I've been struggling with this for years and years and years and years, and I can't seem to find a solution. And we explain what's happening with the muscles and why it's causing sciatica. They go, oh, that makes sense. Well, let me see, I'm going to come in for therapy. And then they come in for therapy. And of course, you elongate that muscle tissue. It takes the pressure off the spinal column, takes the pressure off the nerve. And they go, how did this happen? I've been suffering for so long. It's so fantastic to have relief. And that's what we're here for. That's what we're here for every day. But lifestyle has a lot to do with it. You'd be surprised to your weekend warriors.
Yeah.
So let's talk about that. One, I come to you guys and Ben will explain it to me, how we're doing. And not that I stopped listening to Ben, but I don't understand what he's talking about. So I just want the solution, and it always seems to happen, which is great, And one of the things I love about coming to the shop and getting the robot technology therapy is, what Ben will say is, hey, come 2 times, come 3 times. It's nothing that you have to, it's never kind of come for the rest of your life or come for 6 months.
Right.
It's not like PT where they're like, oh, you have to do this for, the next, So can you go into, I want to talk about two things. One, can you go into a little bit of more detail about how it happens quickly? And two, lifestyle changes that we can kind of put into place to make it stick?
Yeah. Well, I mean, if you look behind us, we've got one NFL player on the table. We've got two people that are just regular people like you and I that, all of them have back and neck pain and some other stuff going on. So it can happen in really any walk of life. A lot of our athletes, it's repetitive motion with how they're training or how their sport is. A lot of weekend warriors, like to Aaron's point, they're doing a lot of golf swings or playing pickleball or tennis, and they're just getting overdeveloped on one side of the joint. And that's pulling their bone structure out of alignment. And the beauty of that is, like, whether you have imaging or not, in most cases, you can see it in the bone structure. And we focus on, hey, there's this big structural imbalance like in your pelvis, and that's pulling your lumbar curvature forward, it's giving you hyperlordosis, you're compressing your lower lumbar discs, and you're getting back pain and sciatica. For us, we look at just elongating the iliacus and the psoas and taking the pressure off that area, and then using therapeutic exercise to strengthen their posterior chain to stabilize them. So it's not, everything we do is incredibly science-based. It's not really anything new. We're just doing it faster with a robot. And that's kind of the idea is, like, if you've tried PT, you've tried chiropractic, you've tried surgery, that's the majority of our clientele. They've come in after they have tried everything else. And not that those things are bad. There's just one of these things, like, if you've got like a really advanced problem that's been there for a really long time, myself included, like if I'm trying to do it by hand, there's really no way I'm going to move the needle fast enough for that client usually.
Yeah.
So it's going to take me weeks to do what the robot does in about an hour. So it's kind of like, I use the analogy when I'm training doctors how to do this. I say, would you rather jog everywhere? Or would you drive a car? The robot's like a car. You just get there faster, So for us, we use it essentially to just open up those spaces that are compressed and realign your postural imbalances. More often than not, that puts you back into a neutral position and your symptoms follow it and just kind of dissipate, or they're very manageable at that point. The majority of patients we see less than 10 times and they're pain-free, or they're at a point where we can see them maybe every 6 weeks or something like that, and it's more manageable. Obviously, there's cases that go outside that, but the majority of people we see, it's 5 to 10 hours worth of treatment, and that's pretty unheard of in what we do. But the thing that makes that possible is the robot. So
yeah, it's great. Aaron, any thoughts?
I think, to Ben's point, one of our clients, I think, said it best. It's body mechanics. It's actually working with the mechanics of the body. The muscular system is basically a pulley system, and it works off of the bone structure. So when you've got muscles that are shortened due to repetitive motion or injury, and they're pulling on that bone structure or impinging a nerve, until you take care of that muscular issue, the pain is not going to go away. And you said earlier when we first started that, Ben you have a pain over here and he's working on your calf. And how does that happen?
Right.
It has to do with relay pain. The teeter-totter is the best way to say that, where when you've got a load on one particular side, it's going to change something in another place. So for people with sciatica, the issue is actually in the front at the hip flexor, at the psoas. And that's actually what's shortened, but it's causing a relay effect all the way around at the top of their buttocks. It's very interesting how the body works, but it really is body mechanics.
Yep.
Okay. Let's talk about, thank you for all that. Let's talk about weekend warrior of what you're talking about. So this past summer, I started playing more pickleball than I've ever played. I golf a lot. I play tennis a lot. I've never had tennis elbow in both my arms at the same time. And since I started playing pickleball. And so, and when I play pickleball, it's like, you're running for things where while I'm 52, I'm thinking I shouldn't be doing this. You know what I mean? Like I shouldn't be I don't need to play at this level. And then I get done playing and I my arms are killing me and I got to call Ben to, blah, 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 blah. So how do you find that balance and integration of lifestyle change when you want to be active, you want to be competitive? Like where's the guidance?
A great example would be, we have a patient we've been treating, great guy, for probably, I'd say over a decade. He's been working with either me or one of our DPTs. And he flies in from Miami about 3 times a year, and he's now in his 80s. And when I met him, he had just no mobility, was in incredible amounts of pain, back pain, knee pain, tennis elbow, a few other things. He was a very avid tennis player his whole life. His doctor told him, "Hey, you're absolutely done playing tennis. You'll never play tennis again." And he was really, distraught about that when we first met. And I told him, I was like, absolutely not. Like, you don't really have anything going on other than like really tight muscles. And I said, let me get you kind of back to neutral. And it took us about, I would say with him, I mean, he had pretty drastic imbalances in about 6 different places in his body. So we fixed the big ones first, then we moved to the little ones. We did probably about, I would say, around 20 hours worth of treatment over about a 2-week period when he was in town. And now, I mean, the guy's in his 80s. He's still playing tennis. He's pain-free. He's avoided several surgeries since working with us, including a knee replacement and a back surgery. And you look at that and you're like, that guy, if he would have gone and done traditional PT, there's virtually no chance that guy would have reached what he wanted to do. So we're not like saying, hey, look, you're going to be done playing this. Don't do this anymore. I'm looking more along the lines of like, how can I get you to a point where you're neutral and you strengthen the right muscles to where playing pickleball is not going to throw you out, because life is short. I want you to go do what you want to do. Yeah. Now, in some cases, like a lot of my clientele are just very honest and they're like, hey man, I'm not going to do the exercises. I just want to come see you once or twice a month. And I'm like, hey, that's fine. I'd prefer you just do the exercises and stay out of my office. But at the same time, if you want to come in, that's fine. So we give each patient like a program that is tailored to them to make sure that they don't come back out of alignment. But you have to stick to it once a week. Yeah. And most people, I mean, we're all guilty of it. You start feeling better, you travel, and you just start forgetting to do them because there's not a necessity. Then, you keep doing the exercises that brought you out of alignment in the first place, and you end up back in the same spot you were before. So to us, it's more functional movement after the robot. The robot isn't everything. It's just a really good tool to get you to neutral. Then after that, we use like traditional PT methods to just keep you there. So.
All right, good. Aaron, any thoughts?
Ben's 100% right. And it's funny chatting with clients on the phone when they just say, I'm not going to do the exercises. Everybody gets something customized. And people find too that they can have a part in being able to do what they want to do, play pickleball. Yeah. We have these exercise bands in the office that everyone has access to, and they can take one with them. And I get the best phone calls from people calling and saying, I've got my band and my back was starting to get tight. I went ahead and did my pull parts just like I was supposed to do. And I'm all better. I just wanted to call and tell you. I said, well, thank you so much. I really appreciate it. And 2 thumbs way up for doing your exercises. So it's amazing. I get back to that seesaw. You can have an active role in keeping yourself balanced and keeping the load where it needs to be so that you can function the way you want to function.
And then to Ed's point, it's really, in most cases, it's an extremely easy imbalance to correct with the robot. I mean, it's like your pecs are too tight and your neck's locking up to fight it. Your hip flexors are too tight and you're getting piriformis syndrome, or your QL is locking up. It's everyday stuff that almost everybody goes through. Now, obviously, there's going to be more complicated cases and stuff like that, and our doctors handle that. But it's in the end, it's usually something very minimal that you're just stuck in this pain spasm cycle that you can't really get out of. And all we do is we go to the source of it and lengthen those muscles, and then we strengthen the opposing muscles to keep you in that neutral position so you don't have to keep coming back to us with the same problem. We're not we don't want to keep people around. We want to get people better, because once you're out there, I mean, how many people have you referred into my office because if you're, we're feeling better? That's kind of what we want to do, is return people to life and then treat new people that need that.
So I want to talk about, thanks for this. I love this talk. I want to talk about the active role that people have to be preventative, and so, it seems to me that, as the average attention span is less than a goldfish, which is 7 seconds. As a business coach, one of the things I find going into companies is that people have a really hard time, organizing themselves, time blocking things that are, critical for themselves, and just doing those things that maybe they need to do, even if it's for a minute a day, right? Like you're talking about the back exercises, Aaron. And so how can people infuse, something preventative, because there's less of a dopamine rush to be preventative than there is when you're kind of in desperate need to get fixed.
Sure.
Like what's the mindset shift of that?
I would just say, I mean, I always kind of equate it to, you don't go to work to go into debt. So I always tell people, like, you don't go to the gym to get pain. Let us just obviously come in for an assessment. I don't want people out there just doing these things and not getting checked first. But in the end, it's kind of like, if you come in, you get an assessment, you get the treatment, we get you back to neutral. I'm going to give you pretty much everything you need to know to never have this problem again and never get back into that old, way of being imbalanced, that old muscle memory.
Yeah.
So to me, it's like, you're already going to the gym, you're already working out, you're already doing that. Why not do the right motions just to keep going? And honestly, in most cases, what they're trying to achieve, like, they're trying to, correct their posture, and they're trying to correct pain, and they're trying to tone up certain areas. If you work the muscles we tell you to work, you're going to get all of that and more, and you're not going to be in any pain, and you're not going to have to stop, working out, and you're not going to have to spend the money to come to us. And I mean, that's kind of our whole business plan, is let us keep you well. I don't want to do it with the robot every 3 weeks because you keep coming back with the same problem. I want to teach you how to do it on your own.
Right. Exactly.
Yeah. Aaron, any thoughts?
You were talking about the mindset. We all know what you focus on grows. And the great thing about keeping yourself in balance is it literally just takes a small change. And it's that compilation of all those small changes that result in the mobility that you're looking for, in the low pain level that you're looking for, active lifestyle, and just those small choices every single day add up to those things. It's like choosing to brush your teeth twice a day, as opposed to right before you go to the dentist and trying to brush them for an hour. It's the day-to-day in and out, small, tiny things that add up. That band pull part that I was telling you about, I use that for myself. I'm on my computer a lot. My arms are in front of me a lot. I have that band. I think it's $8 on Amazon.
You're talking about just like this exercise.
Yep. And it's not even a really thick band. It's actually relatively light, but I hook it on my chair where I work. And so if I just take a minute, and all I have to do is just about 10 of them, and I'm good to go. I'm back in the game. And that took 60 seconds, but it makes the difference in me having a tension headache or not. I'll do it.
In most cases, and this is very generally speaking, the majority of us just need to train like our posterior chain muscles and our upper back a little bit more. If you do that, that covers your neck and low back in most chronic pain cases. It's just people are a little too overdeveloped in the front of their body, and everything's pulling forward. And you can see it in the bone structure. You can see it in the nerves that are getting hit, in their symptoms. And then once we put them back to neutral with the robot, their symptoms go away. And then if you strengthen those posterior muscles to keep you in that neutral position, that's usually all it takes in most cases. Like, it's really simple. It's just coming in, getting the treatment, and then it's the patient actually doing the exercises and staying consistent with it after, which that's I think the hardest part is just, like I said, people they're feeling better and they just kind of don't feel the need to do the exercises anymore. And that's usually when we see them a few months after that. So. And
what are some of those exercises?
Just your standard stuff, like, hip bridges, hamstring curls, band pull aparts, band rows, stuff like that. If people started working those into their routine a little bit more, generally speaking, that would help a lot, just keeping you in neutral. But, it depends on what they have going on. So.
Yeah, I love it. All right, good. So I want to highlight a couple of things. This has been great. I'm a big fan of the product. I've been coming for a long time. rptclinic.com. It is a robot precision therapy clinic, and it's been a game changer for me. I know I refer a lot of people. I get great feedback from all of them. But a couple of things that you talked about, which were, getting back to neutral and keeping yourself well and being preventative, and the mindset, and Aaron, 10 seconds, goes a long way. As a business coach, one of the things I talk about is, it's this, I talk about thinking big, but thinking big, when you reverse engineer it, is doing the small things every day that compound over time. And I think that's where our businesses are very similar. It's about doing the small things, maybe for, a minute on a daily basis, that compound over time for better health, better wellness, better business, better life, et cetera, et cetera. This has been great. I'm going to do a quick speed round with you guys. We'll start with this question. Your brother and sister. So what's one thing you've each learned from each other in business?
I'll go first. Aaron is the wildly organized one, and I would not be where I'm at without her. So she's taught me how to be a little more organized in my own life, and I'm very thankful for that.
All right, good.
Actually, the first thing that came to mind when you said that was Ben thinks big. And I need that because I sometimes get caught up in the weeds and I get caught up in the 1, 2, 3 ABC. And he's like, well, let's look at this picture first. And then you can come in and fill in the details. So we're a good team.
Good. And every good partnership is balanced in that way. I think that's great. A book that's had a big impact for you, or a TED Talk or an article or something.
Oh gosh. I really appreciate the work from Dr. Caroline Leaf. She talks about how to work with your mind and work with your brain and rewire the things. You've got that inner critic that can often keep you from achieving the things that you would like to do. It's a limiter. And to be able to work through the thought pattern that's behind it, and to be able to actually create a new pathway in your brain to think along the ways that's more beneficial for you. I really enjoy her work, all of her books and Ruckus.
It's great.
I would say I'm just a huge nerd and I read a lot of anatomy books. So.
All right, good. All right. Last question. Number one piece of health and wellness advice to get you back to neutral. Ben?
Honestly, move every day, but move the right way. So that's my biggest thing is just, find even if it's not us, find a good functional movement specialist, whether it's a PT or a trainer that really, knows what they're doing, has a good background, and really balance out. So many people focus on the core and a lot of this other stuff that, frankly, you need to just keep yourself balanced. So in most cases, it's tough because actually our NFL player behind us, this is the most common thing I see with our professional athletes and the high level athletes that we work with is they'll come in and, for example, they're saying oh man, my hamstrings are so tight and I roll them out every day, and my trainer and massage therapist, massage them out and I stretch them every day, and they just keep getting tighter. They're tight constantly. And I'll say, let me hit your hip flexors with the robot a little bit, and immediately their tight hamstring lets go. I said, your hamstring is not the problem. I said, your pelvis is being pulled forward by your hip flexors, and your hamstring is just locking up to fight it. And obviously there's, cases where people have injury and stuff like that. And that's, these are more general kind of terms, but in the end, as we elongate the right muscles, those muscles let go, and then we strengthen those to keep them there. But an average person would look at that and be like, I'm already tight back there. They're too tight. I need to stretch them. I don't need to strengthen them and tighten them more, which is actually the opposite. It's you need to get to neutral and then strengthen the right muscles. So I always tell people, I'm the body's meant to move. The problems we usually have are sedentary problems. After just moving the right way, using the right muscles, and you should stay balanced after that. That and drink a lot of water.
Great.
You took mine. I was going to say a hydrated muscle moves and responds differently than one that's dehydrated, and sprinkling some clean electrolytes on that water as you drink throughout the day makes all the difference in the world.
That's great.
Yeah, we get a lot of people in here that are dehydrated, and it's a noticeable difference in their flexibility and their response to pressure from the robot and the recovery speed. It's a big part of it.
It's great. Well, I appreciate you both and everything that you do. Aaron, it's great to meet you. I hear a lot about you, but this is the first I've met you, so it's great to connect with you. Tell everybody who your ideal clients are and where they can connect with you.
I would say anybody and everybody that has pain. Like I said, we treat everybody from pro athletes and Olympians to everyday people that just want to keep golfing and playing pickleball, So, I would say anybody that's tried, PT, chiropractic, surgery, you name it. If you're still having pain, please give us a call. We'd love to help. Good.
All right. Well, thanks, guys. Think community, if you're looking to get back to neutral, we talk a lot on the show about getting back to center. I think getting back to neutral is pretty much the same thing. I agree. You guys are a great solution to be preventative and to help people out of pain. Thanks for everything you do for me, Ben. I don't know how long I've been.
It's been a few years. Yeah.
It's been a while, but it's been great. And I appreciate it and everything that you guys both do to help people feel better and be more active. So thanks a ton. And Think Community, rptclinic.com. And you can reach me at jondwoskin.com. Stay on for just a second, guys, but I appreciate Ben. I appreciate you. Aaron, appreciate you. Thanks so much for taking time to share.
Thanks for having us on. We appreciate it.
Have a good one.